Hello, my name is Sarah Amani. I am the Senior Program Manager at the South of England Early Intervention and Psychosis Program, which is sponsored by NHS England. I am going to share with you my Journey app and the area study, which has been led by Professor Sonia Johnson at UCL. So here's a brief overview of what I'll be covering. Firstly, acknowledgements of who's been involved, a bit of background, and then moving on to how the app and the study was designed, and how the app and its elements were developed, and outcomes from the study, and then lastly, some reflections and conclusions. So firstly, just to say a massive thank you to everyone who's been involved to date. A big thank you to Ali Musa, who helped us to name and develop the initial My Journey app, and the research team at UCL for all their hard work in producing the study and the peer-reviewed articles, which I'll also put a link at the end. And the NHS trusts that have been involved, Camden and Islington, East London, and Surrey and Borders. And also a massive thank you to the app developers, My Oxygen, for helping us with the technical side of things. For more information, you can contact Professor Sonia Johnson at UCL. The link is there for the latest study, which has been published in September 2020, where you can read more about the findings from the study. So a bit of background, in 2011, the early intervention and psychosis team I was working in and managing developed a website with people using services. And it was so well produced and advanced at the time that the project actually was a finalist in the HSJ Awards for Innovation and Mental Health. But what young people who were accessing services told us was that the mobile is a device that they go to for everything, from shopping, socializing, banking. And they wondered why our service didn't have an app to help them recognize their symptoms and manage their distress, and also to keep track of things like their medication. So that kind of was well aligned with the kind of policy context as well. So I've kind of put the more current policies like the NHS long-term plan here, which lists implementation of digital health tools as a key priority. The rationale for that is that there is, most of us now own a smartphone, and it's always on us, and that this could be a way to help people become more active agents in their own recovery and manage some of their own health, reduce distress, improve medication adherence, and the hypothesis being that you could also reduce the likelihood of hospital admissions. Studies have shown that mobile health apps for people with psychosis are acceptable, and that people with psychosis and schizophrenia have equal usage of smartphones than the general public as well. And just expanding on the NHS long-term plan and what it says about the need for digitization of mental health. So they have listed 3 key priorities in their implementation plan, and their priorities are around supporting people to be more engaged in their own care, including access to co-produced digital tools like the My Journey app, which can empower people or give people more control over their own health and care. The key thing also being that these tools have to be safe and secure to ensure privacy, and that most mental health trusts should aim to reach a core level or a mature level of digitization by 2024. And certainly when we started looking at developing this app in 2012, we were wanting to engage the key demographic, which at the time early intervention psychosis teams were seeing people in the age range of 14 to 35 with tools that they were familiar with. So there was a study around this time that young people would touch their mobile phones up to 200 times a day. So we saw that as an opportunity to give uh, to give information to help them navigate the NHS and the services that are available, and yeah, help them to be more actively engaged in their own care. And when we started out with the development, we brought a group together that involved people who used the early intervention and psychosis service, communications manager, and clinicians from the team as well. And we started to think about the smartphone almost like a blank canvas where, depending on the app, the phone changes to either being something you use for navigation, for creativity, for learning, music, chat, or indeed for health. So that's how we kind of started to think about how we would implement this app on a smartphone. And so the way that the My Journey app has developed over the years from 2012 till now, so we're now on version 3, is that every time the app is undergoing any development, it's very much a co-produced effort with people who use services being at the center of the design, the features, how the app works, and everything else. And the My Oxygen team have been key, and they understand enough now about psychosis to be able to implement to translate the ideas into tools that are an app that's easy to use. And some of that work started out really, really simply, like just drawing things on paper and sharing that within the group to see whether the ideas had translated properly into something they could actually visually see. And doing it on paper meant that we weren't spending money prematurely before we finalized some of those ideas. When we did actually agree on some of the concepts, like what each screen would look like, what each function would do, etc. At the time in 2012, I actually didn't have a budget to do this. So I went to a few universities to ask whether their computer science students would be happy to help with a minimally viable product. So a very simple proof of concept mobile app. And that worked actually. So I managed to work with a student from Keele University as almost part of his coursework to develop the first iteration, which looked a little bit like this, very simple in a way. Kind of had a medication counter, very, very basic sort of app. And because we had this award-winning website, we kind of took some of the information from there to kind of populate the app as well. So this is what we ended up with. This is the My Journey app version 1. So this was completed in 2012. It was available on Android smartphones in the Google App Store, and in fact, I think you can still find it there. And this is just another screen of what that looked like. And because around that time in 2012, 2013, there weren't actually many research studies as to what the impact of mobile health apps were on the individual using them, as well as their usage of clinical services. I started to look for funding to see whether we could do a study of the app rather than assuming that it was helping people to actually investigate whether it was, and what the views of people were who actually used it. I was quite fortunate. Around that time, I met Professor Sonia Johnson from UCL, and I remember meeting her at Waterloo Station. I had the phone app on me and kind of said, I'd really love you to do a study on this if you would. And yeah, I'm really lucky that she said yes, and her team have taken this on and developed the app further. Because the original could help track symptoms, as you can see here, and track the usage of medications. And it had a jargon buster where words that we use in the NHS could be explained in more everyday language ways. It it didn't have other features though, like a plan for staying well, a contingency plan about who to call in emergencies, that sort of thing, and a wellness and recovery action plan, essentially. So those features were added in version 2 and version 3 of the app. And so we're currently on version 3 of the app, so that now has a relapse prevention plan, a recovery plan, and a way to track symptoms, and also to track achievements for that reinforcement as well. So the feasibility study was published in 2019, and those are the findings that I will be sharing with you shortly. And just to start, the design of the study is, like I said, feasibility trials and conducted by Professor Sonia Johnson and her lovely team at UCL. And the aim of the study was to identify whether a supported self-management smartphone app is acceptable to use in EIP services, and to test the feasibility and acceptability of the trial procedures. So this was a feasibility randomized controlled trial comparing people accessing early intervention and psychosis teams who received treatment as usual, that would be the control arm, versus people who are receiving treatment as usual, and also the My Journey app. And the study aimed to recruit 40 participants in EIP services across 3 trusts, and the data would be collected at baseline, 4 months, and 12 months follow-up. As well as the data, there were also qualitative interviews with participants and clinicians. And the treatment group was 20, and then the control group 20. The treatment group would receive the My Journey on their own smartphone. This was limited again to Android smartphones. And they would then have a training session on how to use the app with their clinicians. And they would also receive clinician support, although this wasn't manualized. And the main outcomes that they were looking to see is the participant recruitment and retention, and also whether the intervention, the My Journey app itself, was acceptable. So the data collected was self-report questionnaires, self-rated recovery, self-efficacy beliefs, mental well-being, quality of life and satisfaction of treatment, symptoms, and engagement with mental health services. And some of that data was taken from the electronic health patient record, so things like the diagnosis, the use of mental health services, number of appointments, that sort of thing. And they would also look at how often the individual used the app, and also track the retention rates, as I mentioned before, of how many participants were still involved with the study and using the app at 12 months follow-up. And their criteria was that the participant had to be aged 16 or over, on the EIP caseload, English speaking, have capacity to give informed consent, not at high risk, and that they also owned an Android smartphone. And the final sample ended up being 70% male, mean age of 30, 37.5 were white British, 25% were in paid employment, and 25% had previously used a mental health app, and 72.5% had a diagnosis of schizophrenia or related disorder. And the findings are as follows. All the participants in the treatment group, so all 20, attended the mobile app training session to get familiar with the My Journey app, and they all had access to My Journey during the study. The median length of time from entering the study to having access to the My Journey was 14 weeks, and the median length of time with access to My Journey was 38 weeks. And there were no research-related serious adverse events throughout the study. So 40 participants were recruited over 7 months, and at 4-month follow-up, they had 83% still involved in the study, and at 12 months, that they had 75%. So still pretty high retention rates. And patient record data at follow-up was available for 38 of the 40 individuals involved, so 95%. And here's some of the kind of outcomes with regards to retention and use of the mobile app. A small minority didn't use the app at all. And there was also a small, I think one who stopped using it after 1 month. Majority used it for between 1 to 3 months, and about 5 for longer, between 3 to 6 months. And equally, about 5 were still using it after 6 months. And this study also involved qualitative interviews, as I mentioned before. So these are some of the quotes from the participants. So this individual, the participant, had real hope that it would help. Quite open to the idea of trying something like this and seeing whether it would help them. And a clinician was equally optimistic and thought that they would find it beneficial because, clinical services are typically open 9 to 5, but certainly EIP. So whilst the individual service user is not seeing their clinician, they could continue using this app to reinforce some of the stuff that they've done in a session. And its perceived effectiveness, those positive sort of view that it was good. There was a bit of concern, though, with the burden that this might add to what teams were already doing. So I think there's something about making this part of what clinicians do anyway, because like this clinician mentions here, they might have remembered it at the first appointment or second appointment, but some clinicians kind of forgot to mention the app in follow-up appointments, so weren't really supporting the use of the app on an ongoing basis. So I think this is a participant's view, actually, that using the app whilst doing the relapse prevention plan was very useful. So yes. And this, I think, just reinforces that when implementing mobile health apps, I think there needs to be quite a lot of thought given to how the clinicians can support its use. Because without that, there seems to be, maybe after a short period, the use of the app drops because there isn't the attention paid to it anymore. But some participants who maybe are more digitally savvy or technologically savvy didn't really feel they needed that extra support. So I suppose it just depends on how confident people are with technology as well. There was some concerns from some participants about putting data into, a mobile smartphone, just to say that the app doesn't actually keep any or send any data unless the participant chooses to share their relapse plan, for instance. But that was something that also came up with some participants. So this was feedback, I suppose, towards the training session, which seemed to be pretty key before implementing the app itself. So I think that training session, certainly for this clinician, was useful. And it goes back to individuality here, I suppose. Of some people really do not like technology at all, and so this again, the need to cater to a range of people and understanding that this app, and indeed any health app, is not necessarily going to meet the needs of everyone or be a preference for everyone. And another point here from a clinician about the risk of sometimes losing the kind of the therapeutic nature of the appointment if all the attention is drawn to the app. And so, yeah, it's something to keep in mind. So just some brief conclusions and reflections, really. The feasibility study certainly showed that the app is acceptable. There was 75% retention at 12 months, so people were still participating in the study, um, 12 months after the beginning. And there were no adverse events during the study, so it seems the app itself is safe and acceptable. A promising sort of potential effectiveness, particularly I think with the relapse prevention element within the app. Um, there is a question about how we get more usage and people kind of keeping the use over a longer period. I don't think this is something that we've quite cracked yet with digital health apps, but that's certainly something perhaps for future studies. One idea would be maybe to manualize the clinician support so that it's quite clear what kind of support the clinician can provide people using services who use digital health apps. So that's everything. Thank you for listening.